switched to using an elliptical rider, which is a lot like standing up on a bicycle, where there's your motion, but you're not having the impact, I probably got another year or so without having surgery because it strengthened my legs and helped my joints.
And one of the mistakes that people make with treadmills is, most treadmills in health clubs incline. And as soon as you go into an incline, remember how we were saying steps and hills are killers for knees? Well, you're introducing that right away. So if you are going to try the treadmill, it's best to do it flat, completely flat. And like LaDonna said, the next step is certainly the cyclical kinds of trainers as well, which are completely low impact.
And again, the programs that you can get for free through your Medicare supplement insurance policies, the strengthening, the flexibility, the coordination, and the balance. And I have seen tremendous changes in people who come to my gym. They talk about the changes in their memory and their cognitive function, as well as the changes in their balance and the lessening of the pain in their knees and hips.
A lot of our patients enroll in the Silver Sneakers and the Curves programs, which I really think have been excellent programs because they're very group-based activities, but in a sort of a non-threatening environment too. So, although LaDonna goes to the real gym kind of place, sometimes people don't like to be in that kind of situation. And Curves and Silver Sneaker Grade, and like LaDonna mentioned, many of your insurance plans cover that. They cover, remember? Yeah. So you should check it out. I mean, something for free from an insurance company that don't always get. Whoops. This is for Anton. I have arthritis in one hip or knee. Does that mean that I'm destined to get arthritis in the other hip or knee or other joints?
It's totally not true. You may have arthritis only in one knee and one hip, and we still don't know the reason. And as Tony was giving you this story about growing pain on one side and knee pain on the other leg, and it's truly still a mystery to us. And probably in his particular case, probably he torn a labrum we talked about before on his right side, and he lost some fluid pressure in this joint, and it just slowly building up. But again, there is another group of patients who has rheumatoid arthritis, different kind of arthritis, have genetic predisposition, and it's a very complicated story, and we truly don't know. But the answer is no. It could be in one.
And I think too, one of the things, just as an observation, it's not really scientifically proven. I think a lot of patients that come in and have one knee problem, many more times do develop the second knee problem, but that's not necessarily true in hips. We have a lot of patients that end up having one hip replacement, but don't ever come to need the other hip replacement. So, again, I don't know if there's any long-term studies. It's just sort of a gestalt that with the knees. And certainly, as Anton said, if you have an injury to any of those joints, you're definitely more prone to developing arthritis. Or in the case of hips, remember, some hips don't form normally as a child and through adolescence. It's called dysplasia. And you would never know you have it until you get arthritis, because dysplastic hips, which are shallow hips, are all definitely at risk for arthritis. That doesn't mean 100% they're going to go to arthritis, but they're at risk for arthritis too.
Tony, there's one, something that's intriguing. If you look at gout, what joint does gout affect? It's the great toe, your first toe. Now, why would that be the case? And it's very interesting of thinking about that. If we take a look at osteoarthritis in your hands, these end joints, we call them the distal interphalangeal joints. I showed you on that one picture. It turns out that that's very genetic. That's 10-to-1 females to males. And my grandmother and my mother both had osteoarthritis of these end joints. And it's very interesting that you can turn on and off genetic information in individual joints. So that's one thing. And if we look at the cartilage, from an orthopedic perspective, trying to transplant cartilage, it turns out the cartilage in the knee and the ankle and other joints are not all similar. There are little differences. And so certainly genetics is going to play a role, and then you put on these other factors, these mechanical factors. You know, if we take a look, what's intriguing, remember the x-ray of the knee I showed you, that was the outer, the lateral compartment. You know, the ones that you show were the medial compartment. And it turns out that the width of the pelvis makes a big difference. You know, if looking at kind of gender differences, the pelvic width might be a little bigger in females to have children. And so that means the angle that comes down and the stresses placed on the inner part of the joint is certainly greater in women than in men. And what Tony says is correct. I mean, it is amazing. Most of the people, unless they've had injury, it's like the football players or other individuals who've had injury to the knee, you know, that gives you one knee involved. But a lot of people have both knees involved, and far less have both hips involved. You know, it's very unusual, actually, to have, it's not that we don't see it. If that occurs like with rheumatoid arthritis, that's why our new treatments of rheumatoid arthritis have to be aggressive. You know, it's when I first started, we used to wait 2 years arbitrarily before we used what are called disease-modifying drugs for rheumatoid arthritis. That was ridiculous. You want to get these diseases as early as possible. That's actually the great challenge of individualizing treatment very intensively at the proper time so as to prevent damage to the joints, because once that happens, it can certainly result in further damage and degeneration.
Question for Anton. It's about called Baker's cysts. How many people have have been told they have a Baker's or a popliteal cyst? Good. This is a common question in the office. I have a Baker's cyst in the back of my knee. Do I need to have that removed, and where does it come from?
Well, I mean, you saw a lot of x-rays today, and when you have arthritis, there is a debris in the joint. So when you're wearing your joint off, it's a closed space. It has a capsule, and the debris stays there. I mean, more you're wearing, it's more debris inside of your joint, and it's trying to find the locations. We can see later in life, we can see all these osteophytes, little bone spikes on the side of a joint, or the Baker's cyst, another representation of the capsule, is basically just a capsule bulging on the back of your knee. And just by the gravity, all these particles, they just go and sit somewhere in your joint, hip or knee, and according to this question, some days are good, some days are bad, because they cause inflammation. It goes through the cycle. One day, the weather is bad, everything gets inflamed, you feel like knee feels horrible, it's very stiff. The other day, it feels better. It's sort of it's a very cyclic process. But going back to the question about Baker's cyst, it doesn't have to be removed. If you drain it, it's basically you'll build it up again. And a treatment for it would be treat your arthritis in the knee and stop the production of those particles.
No, the most important thing to realize is there's an underlying problem with the knee that causes the Baker's cyst. The Baker's cyst isn't the problem unto itself. So my advice is you certainly shouldn't let anyone operate on your knee just to take out a Baker's cyst, because more than likely you do have either arthritis or inflammation in the knee that's causing it, and it's a very dangerous place to operate to begin with, because all your arteries and nerves and veins run back there, and you're not going to get a cure. So think of it as a secondary sign of something going on inside the knee more than a primary problem itself. It can be very annoying, don't get us wrong, but there's other things to do, like injections, that can help that. This is for Megan. I see a lot of people wearing ACE wraps and sleeves around my knees and things for when I exercise. And do those kind of things help?
That really depends on what they're wearing it for. Sometimes it's for some support from an injury they have. Sometimes if your patella or your kneecap is not in the correct place, some people will use them for that. In terms of arthritis, I quite honestly do not know that they're necessarily beneficial. If it can add some protection to your joint, I suppose, and maybe it goes back to kind of how Dr. Starr says, if it's working for you, and that's great, but honestly not sure about the research behind it and exactly if they're beneficial. I don't know if Anton or